5 things older men should never do while masturbating. Protect your prostate and whole body health. As men age, the body goes through many changes. Hormonal shifts, slower metabolism, reduced muscle tone, and changes in sexual function. The prostate enlarges, circulation becomes less efficient, and tissues become more delicate. Yet there's one topic that remains rarely discussed: masturbation in older age. While some might feel embarrassed to bring it up, the truth is, solo intimacy remains a part of life for many men well into their 60s, 70s, and beyond. It can offer relaxation, a sense of vitality, and connection to the body. But without proper awareness, some long-standing habits from youth can quietly become harmful in later life. As a men's health specialist with over 30 years of experience, I've treated many men suffering from urinary problems, chronic pelvic pain, prostate inflammation, or even emotional disconnection from their partners, all of which stemmed in part from how they approached self-pleasure without adapting to their aging body. This guide will walk you through 5 critical mistakes older men often make while masturbating. Mistakes that may seem harmless, but can lead to discomfort or even medical complications over time. These insights are not here to shame or judge, but to empower you to care for your body with more awareness, patience, and respect. Mistake number 1, not emptying your bladder before starting. One of the most overlooked but risky habits is masturbating with a full bladder. You might think, "I'll go afterward. It's no big deal." But after the age of 60, the bladder loses elasticity, the prostate may enlarge, and the urinary tract becomes less efficient at fully emptying. Any pressure in the pelvic region, like during arousal, can cause urine to be pushed backward, increase leakage, or lead to discomfort during climax. More seriously, retained urine under pressure creates an ideal environment for urinary tract infections, especially when combined with friction from self-stimulation. I once treated Carl, a 77-year-old man who came in fearing he had prostate cancer due to nighttime leakage and painful urgency. After examination, it turned out that he simply wasn't urinating before masturbation, and his aging bladder couldn't handle the pressure. Key takeaway: make it a habit to always urinate before self-pleasure. It may seem like a small detail, but it can protect your urinary system, reduce the risk of infection, and make the whole experience more comfortable and stress-free. Mistake number 2, using a tight grip or moving too fast. Another common mistake is one many don't even recognize as harmful: masturbating with excessive pressure or at a rapid pace. What felt good and worked in your 30s or 40s may now be doing the opposite. A tight grip repeatedly stresses the penile tissues and compresses the sensitive nerves, especially near the head and shaft. Over time, this can dull your sensitivity, make it harder to enjoy partnered intimacy, or even lead to what's sometimes called death grip syndrome, a term health professionals use to describe men who can only climax with a very specific, intense stimulation pattern. I recall Henry, 69, who confided that he hadn't felt pleasure with his wife in nearly 2 years. The issue wasn't desire. It was that he had conditioned his body to respond only to fast, intense solo stimulation, making natural touch feel ineffective. Besides the desensitization, older adults with heart or blood pressure concerns need to be especially careful. Fast, high-pressure activity can spike blood pressure, cause dizziness, or strain the cardiovascular system. Key takeaway: ease up, slow down. Use a gentler, more natural rhythm. You're not racing to a finish line. You're honoring your body. Sensuality in older age is about comfort and connection, not force or intensity. Mistake number 3, ignoring prostate warning signs. Many older men overlook one vital truth: your prostate health and masturbation are closely connected. While solo activity can support prostate health in some cases, doing so without listening to your body can make things worse, especially if you already have an enlarged or inflamed prostate. If you notice pain or pressure during or after climax, discomfort when sitting for long periods, pelvic aching during bowel movements, weak urine stream, frequent nighttime urination, or incomplete emptying. These may not be just signs of aging. They could be indicators of prostatitis, inflammation, benign prostatic hyperplasia, BPH, or chronic pelvic tension. Tom, 74, ignored these signs for nearly a year. He kept masturbating out of habit, even when it felt uncomfortable. Eventually, he was diagnosed with chronic prostatitis, and recovery took months, much longer than it would have if he had listened to his body earlier. Key takeaway: don't push through discomfort. If something doesn't feel right, stop, rest, and talk to your doctor. True strength comes from self-awareness, not stubbornness. Mistake number 4: using unsafe products or improvised tools. What you use during masturbation is just as important as how often you do it. And for many older men, this is where serious mistakes happen. Some men reach for household lotions, oils, or gels without checking ingredients. But aging skin is more fragile and more prone to allergic reactions, especially to products with alcohol, artificial fragrance, or harsh chemicals. Others try to enhance the experience with objects or devices that weren't designed for the body, creating risks of micro tears or cuts, bacterial infections, blood vessel damage. Walter, 68, had used a homemade device for years without issue, until one day his skin didn't heal. A small injury turned into a painful inflammation that sent him to the ER. The physical pain healed faster than the embarrassment. Even legitimate sex toys can be risky if not cleaned properly. For older men, especially those with weakened immunity or diabetes, a minor infection can become a major problem. Key takeaway: choose products that are body-safe, unscented, and made for sensitive or aging skin. Never improvise with untested objects. Clean your tools thoroughly and always prioritize safety over novelty. Mistake number 5: masturbating right before bed, without recovery time. This may surprise you, but the timing of your self-pleasure matters, especially if you do it right before falling asleep. Many men believe it helps them relax and fall asleep faster, but for some older adults, the hormonal changes and nervous system response to orgasm can actually disrupt sleep, causing light, restless sleep, vivid or disturbing dreams, grogginess the next morning. There's also a circulation issue. After ejaculation, the prostate contracts and gradually relaxes. But if you remain lying down and fall asleep immediately, blood flow can remain sluggish around the pelvic region, causing soreness or a sense of tension when you wake up. Dennis, 73, couldn't understand why his lower back and groin felt sore every morning. It turned out he was masturbating just before bed and then going straight to sleep. Once he began taking 10 to 15 minutes to stretch, walk, or breathe deeply afterward, the pain disappeared. Key takeaway: if you choose to masturbate in the evening, give your body time to recover. Sit up, drink water, breathe slowly. Let your circulation normalize before bed. That small shift can greatly improve your comfort and sleep quality. Final thoughts: growing older means listening deeper. If you've made it this far, thank you. It shows that you care, not just about pleasure, but about protecting your long-term health and honoring your body as it changes. Masturbation is not shameful. It's a part of human life. But just like exercise, diet, or sleep, it must evolve as your body evolves. The 5 mistakes we explored today are not rare. In fact, they're incredibly common. But they're also easy to fix once you become aware of them. Let's recap. Empty your bladder before you begin. Use a gentle grip and slow pace. Pay attention to warning signs from your prostate and pelvic region. Use safe, clean, body-appropriate products only. Give yourself time to cool down before going to bed. The key message: what worked at 30 may no longer serve you at 70, and that's okay. It's not weakness to adapt. It's wisdom. And your body, no matter its age, deserves kindness, attention, and care. even in its most private moments. So now I ask you, was there something here you hadn't thought about before? Is there a small change you'll try tonight or tomorrow? We'd love to hear your thoughts. Leave a comment and share one thing you learned today. Your story may help someone else feel less alone. If you found this guide helpful, please like, subscribe, and share it with someone who may benefit. Your support allows us to keep making honest, respectful content for older adults navigating real issues with dignity. Thanks for being here. And remember, you're not past your prime, you're in your wise years. Treat yourself like it.